Hello, and welcome to Cultivating Resiliency for Individuals and Communities in a Post-Pandemic World, co-presented by Healthcare Council of Chicago. My name is Angel Moore, and I'm the Special Events and Committees Manager at Community Health. Community Health is the largest volunteer-based free health center in the United States. We provide primary and specialty care, prescription medications, mental health and dental services, health education, and labs, including COVID testing and vaccines, on the west side of Chicago. Our patients have no health insurance, and we provide all of our services to them at no charge. We do this with the support of over 1,000 volunteers, partnerships with dozens of institutions, and donations from generous people like you. Thank you for being here and for supporting Community Health. I would especially like to recognize our many sponsors who are supporting this year's All In series, including Baxter, AbbVie, Lundbeck, the Joseph and Bessie Feinberg Foundation, West Monroe Partners, and many others. I encourage you to visit our website, allinchicago.org, to see the complete list of sponsors, read the bios for our incredible speakers, and check out the rest of the month's events. Finally, I want to recognize this year's All In Executive Leadership Council. We have the privilege of having 4 outstanding leaders serving on the council this year. Their great insights and support have been instrumental in bringing this year's series to life. Thank you to Dr. Jay Bott, Mark Ishaug, Brian Marcella, and Dr. Julie Morita for your contributions this year. You'll hear from one of the members of our Executive Leadership Council, Mark Ishaug, moderating today's panel. The goal of the All In Chicago series is to bring together leaders from many different industries and segments of our population to talk about how we can work together to ensure every resident has access to the right care in the right place at the right time. Community Health has been hosting all-in events discussing access to healthcare in Chicago since 2015. This year, as we continue to navigate a global pandemic, the conversation around access feels as relevant as ever. COVID-19 has brought on not only public health challenges, but concerns about our mental health as well. Isolation, working unusual or longer hours from home, family and other competing demands have taken a toll on many of us. Today's panel will address their findings and observations on this topic, as well as suggest some strategies to help us cope, both individually and collectively. I will now be turning things over to Megan Phillip. Megan is the Executive Director of HC3, the Healthcare Council of Chicago, our co-presenter today. HC3 is an action-oriented collaborative that brings leaders together from across the healthcare system to address Chicago's most important health-related issues. Megan is also a member of Community Health's Associate Board and has been involved in our All in Chicago series since 2016.
Thank you, Angel. And I'm just going to take a moment, go slightly off script, because I just want to acknowledge how wonderful it is to be co-hosting today's event. These past 18 months have been challenging in many ways for all of us, but I am always so humbled whenever I have the opportunity to check in with folks from Community Health. They have remained steadfast to their mission to serve, and thanks to their courage during this time, we have gotten through some challenging times for their patients. The strength of this organization is truly illuminated by the values they instilled from the board and leadership to the frontline staff and volunteers. To say that they have been resilient is an understatement, so I just want to take that moment to say thank you and recognize the remarkable staff and volunteers that have led with hope and empathy throughout the pandemic at Community Health. So today, loneliness and social isolation are serious public health risks that have affected a significant number of people across the US and have put them at risk for serious medical conditions. 61% of people living in the US experience loneliness, and in the COVID-19 area, only 30% of full-time workers have exhibited high levels of resiliency or the ability to recover quickly from challenges. Although not everyone has been diagnosed with a mental health condition, everyone does have mental or emotional health needs that can be exacerbated from stressful working conditions, feeling isolated and alone, or having an unstable home environment. And at a time like this, we need resilience. It is my pleasure to introduce our moderator for today's conversation, Mark Ishaug. Mark is the CEO of Thresholds. Thresholds provides healthcare, housing, and hope for thousands of persons with mental illness and substance use disorders in Illinois each year. Through care, employment, advocacy, and housing, Thresholds assists and inspires people with mental illnesses to reclaim their lives. Without further ado, I will hand things over to Mark to introduce our panelists. Thanks for being here, Mark.
Uh, Thank you. Thank you so much, Megan. Really appreciate you and appreciate being here today with just this amazing group of leaders who you're all going to hear from in just a second. You know, when we started planning this, I don't know, months ago, we included in the title Post-Pandemic World, Cultivating Resiliency for Individuals and Communities in a Post-Pandemic World. I'm not sure that today, as we do this have this discussion together, that's actually the correct title. I think we are in an ongoing pandemic and multiple pandemics, in fact, COVID, racial justice and injustice, violence, climate change, democracy and attacks on it, economic inequality, et cetera. So as we have this really rich discussion with these fabulous panelists, I hope you in the audience have all of these things in mind, the ongoing pandemics, and to my four esteemed guests, you as well, as we start to talk about these challenging moments and exciting opportunities in an ongoing pandemic world. So with that bit of framing, I'm going to just introduce as quickly as possible so we can get into a rich conversation our four guests today. And I'm going to start with Colleen Cicchetti, who is the executive director, there she is, of the Center for Childhood Resilience, a clinical psychologist at the Ann and Robert H. Lurie Children's Hospital of Chicago, and an associate professor of Northwestern's Feinberg School of Medicine. Colleen, I have Dr. Cicchetti here on my notes, but I'm calling her Colleen for the rest of the morning. With her permission, has over 30 years of experience in hospital, outpatient, and community settings. And she's passionate about and committed to addressing health disparities and decreasing exposure to violence and trauma for children and families through innovative, healing-centered public health strategies and multidisciplinary collaboration. Next up is Kim Laube, who is the executive director of the Human Understanding Growth Services, otherwise known as HUGS, Inc. I love that more than I can tell you. Located in West Hampton Beach in New York, way out on the peninsula. Is that a peninsula? And in this position, she brings over 30 years of experience in substance abuse prevention, knowledge and expertise. And she's leading this great organization to provide a full array of multidimensional prevention services. Kim's a national trainer and a speaker, and I've had the pleasure of sharing the stage with her before here in Illinois, and really excited to have her on screen with us today. Third is a new friend who I just met, but may be well known to many of you, Denean Pillar Jackson. There she is, who joined the Corporate Coalition of Chicago as the founding executive director for the Chicago Resiliency Network in March of this year. Denean is leading the network's efforts to inspire employers to think differently while acting collectively to acknowledge, address, and solve for trauma triggers that can inhibit success in their workplaces. And last but not least, Gail Smith. Is she popped up there? There she is behavioral health clinical account manager who acts as a subject matter expert to the Cigna sales team, supporting new business managers, client managers, and market leadership within the sales organization. She possesses in-depth knowledge of advanced market issues in Cigna's behavioral health products. She partners with behavioral health operations to maintain a working knowledge of all the clinical, health partners, and operational processes necessary to support clients and the sales team. So welcome panelists. And before we just get started, I want to remind folks that are out there in the ether watching and listening that you can send questions through the Q&A function, I believe it is, and feel to write questions at any time, and we will do our best to answer as many as we can during the program, some voice and some through a chat function. So I'm just going to get started, and if you don't mind, Colleen, I'm going to start with you. I think just for level setting, it would be really helpful if you could just briefly describe or define, I should say, trauma. What does that mean? I think we know it when we hear it, or we know it when we see it, but what do we know when we don't sort of hear or see it in the same way? As with resilience, what does that actually mean for individuals and organizations? So I'm going to start with that, and then I'm going to do a follow-up about school, which just started for many of our kids. Thanks,
Yeah,
Tom.
thank you so much, Mark. I'm happy to talk about that. I've actually been part of the community in Illinois that's been actually struggling with coming up with a true definition of trauma for about 15 or 20 years. So it isn't as simple as it sounds. And I think for those of us that have been in this field, like all of us on this call, we have been working really hard to get people to understand the word trauma for a long time. And now it's become a word that's being thrown around a little bit too loosely from my perspective. So being able to kind of define what we're talking about as we move through this conversation is really important. So the work of the Child Trauma Coalition in Illinois has been based on the idea of there being kind of a consensus around something that might be easy for people to keep track of, which is the 3 E's. And the idea is that there is an event, something extremely scary, something that's really disrupted your world that you have been exposed to. It could be one thing or a series of things that go on for a long time. But there's more to it than the event. There's actually how you experience the event, how close you are to it, how old you are when it happened. Are you able to make sense of what's happening? That's where it might be different, where you might have families that have all been exposed to the same thing, but they may manifest that differently. And then the final one is that effect. It's how does it affect you? We all know that after you've been through a scary event or a loss of a loved one, there's a period of time where you're grieving, where you're experiencing that. But when we're talking about trauma and the impact, we're thinking about things that kind of go on beyond that. They're not just affecting you for the first few weeks or months, but it moves beyond that. And it's not just affecting one domain of your life, but it's really expanding and it's starting to impact your relationships, your sense that the world is safe, your trust of other people. And so when we think about trauma, we really want to be thinking about it in that continuum. And yet we also have moved that definition, not when we first started, some of you may be familiar with ACEs or the adverse childhood experiences. And the field started with that idea. And those are things that happen within a family. But increasingly we're saying, yes, the ACEs are important when trauma happens in the context of relationships of the people who you love and are supposed to protect you. Those are very impactful. But there are many other types of trauma. So trauma can include exposure to things that are happening in the community, like violence. We've also increasingly been thinking about, those long-term things that can happen, bullying in schools, or the feeling that you're being treated differently by others around you because of your race or where you live or your zip code. So when we talk about trauma now, we're really thinking about that expanded definition that thinks about trauma as both what happens to an individual and throughout their community and in their environments, but also what happens to a whole community and how they're experiencing the world. And we're thinking about that in terms of things that are happening right now, but also thinking about the systemic and historical things that have happened. So we do want to really think about trauma across that context. It's multiple things that can impact any of us at any point in our life. And the more exposure you have to it, the more impactful it can be. So that's also important. So when we talk about trauma, that's what we're talking about. When we talk about resilience, we're talking about how is it that we prepare ourselves to manage through the crises around us? How is it that we make sure that all of us as young people and through adulthood have the inner resources to manage what's coming at us, as well as the external supports? Resilience is not something you're born with. It's not a have or have not. It's a tool, it's a muscle that grows, and the way it grows is in relationship with others. So we want to be careful of not saying that this person or that group is resilient and this person or that group is not, but instead say, how do we make sure that we are creating a community where everyone's developing the skills to manage emotional distress, to reach out to others when they have help, when they need help, and to have some skills themselves, and also recognize that the exposure to the trauma can look really different. So those are kind of those two core definitions, Mark, I think are important to understand.
Thank you. Really fantastic level setting. And before I turn this over to Denean, who will describe her new but amazing work in resiliency for, I think, corporate Chicago, but bigger than that, really. I know everybody top of mind right now, excuse me, is school and kids back in school and parents trying to get back to work when they have kids in school. And everything going on with COVID 2.0 as we speak, which is so different from COVID 2.1 or 1.1, whatever that was last September. Right. So just before we move on, can you just share sort of your thinking right now, since school I know is top of mind for maybe most of the listeners today and viewers?
Absolutely. I mean, I think my work is really tied to schools, and we've been hearing from educators and parents alike that there is incredible concern over the emotional well-being of our children. We know that over 76% of parents have reached out to their pediatrician or somebody to say that they're concerned about their child's emotional well-being during the course of this pandemic. And we know that a lot of people were really looking forward to the return to school and the sort of back to normal that even our title reflected. And unfortunately, that's not happening. So what we're seeing instead is we're living through this pandemic, and we all have to manage it. And I think what I can say in terms of schools is schools do need to be prepared. Like I said, lots of people have reached out, and there are resources that we can talk about. But I think this is a place where it's really important to think back to that definition of trauma, because when we talk about trauma, it is not just stress. What I would say is that all of us have had a communal experience of stress. Our lives have been disrupted, our routines have been disrupted, we've missed out on things that were important markers of development. All of those kinds of things are stressful. But there's a subgroup of kids and families that are experiencing what we consider toxic stress. And those are the folks for whom this year has been really impacted, not just by the pandemic, but insecurity of food or housing, exposure to the increasing violence, the feeling that domestic violence has increased. We've seen issues of substance abuse increasing. So kids are living in communities and families where that is a toxic level of stress that they're bringing back to school with them. And then there's a much smaller subgroup that have actually had trauma. And those are the kids for whom there's been a traumatic loss. They haven't been able to say goodbye to a loved one, or they've seen violence occurring right in front of them. So I think having that in your mind helps us think about the return to school. Because the fact is, kids are naturally resilient. They have been with their families for the most part. So many of them are coming back to school anxious, uncomfortable, not knowing what the new norms are, just like us as adults. And yet they're going to be okay. And they're going to be able to connect with their teachers and reestablish those relationships with adults that they trust and build on their social emotional skills. But there are going to be other kids for whom this year has been much more difficult. And that's really what my focus at our Center for Childhood Resilience is, equipping those adults to both be welcoming and to build on the natural resilience, but then also to be able to identify which kids need more and get those connected to the services either in the school or in the community and work with parents around that. And so I think it helps a little to realize it's not every kid is traumatized, but there is a need for an organized approach to matching the right kid to the right intervention. And the more educators and parents are in communication, the more we can determine which kids those are as soon as possible and really help kids get back to the business of not just learning, but socializing and being with one another.
Well, thank you, Colleen. I can't tell you how much I needed to hear, and I won't speak for anybody else, but the kids are naturally resilient and that the kids are gonna be okay. That allows me to breathe a little bit easier right now during this very difficult conversation. So thank you for that.
And we are going to have to put resources to make that happen for the ones who are
Exactly.
struggling. And it's going to take time and effort, and everyone on this call knows that. But it is going to sort itself out, and we're all going to be able to, if we put this as a priority, meet the needs of everyone in our communities.
Yeah. So Denean, I'm going to turn to you. Welcome. It's good to see you this morning. Can you talk a little bit about your what feels like a brand new organization here in Chicago, and specifically what role that your organization plays in the work to address trauma and build more resilient businesses, if you will, here in Chicagoland and beyond.
Absolutely. So good morning, everyone. It is such a pleasure to be here with you today. As you mentioned, I'm the executive director for the Chicago Resiliency Network. And the Resiliency Network is under the umbrella of the Corporate Coalition of Chicago. And as you described, the coalition as a whole, we're working to solve for inequities and disparities that are occurring in the Chicagoland area and wider. And as the results for the Resiliency Network, we understand we're working with corporations for them to adapt their practices to help their employees understand trauma and also how to be more resilient. So how to create those healing-centered workplaces, if you may say. And Dr. Cicchetti said it perfectly. With kids, there are a lot of interventions that are being created to help them in schools. So in that area, we're going to create a community to support our children. We also have adults. And as it relates to them, they are experiencing the same type of traumas as well as toxic stress. And bringing that to the workplace can inhibit how productive they are, how long they stay in their roles. And even as we look at this return to work, how they can re-socialize themselves as well. And so you guys did a wonderful job with creating the foundation of the why for all of our work. And so at the Resiliency Network, employers recognize, if you think about it, there's a war on talent. Right now, there are record number of job openings that are occurring, as well as layoffs are at a low. And so employers recognize that they have a role too. Employees are with their teams for 8 to 10 hours a day. So for the benefit of that organization, they have to look in a different way of how to support their employees. And so the Chicago Resiliency Network is one of the answers that employers are looking to help provide them with training. So in short, the Resiliency Network is a cohort-based model for working with organizations to train them on best practices to help them create those healing-centered workplaces. We work over a 9-month period where the cohort meets twice per month. And basically we're focusing on 3 areas. So one, the training and the learning. We partner with an organization called Kentla. Kentla is co-founded by Dr. Bruce Perry, who's been working for decades supporting childhood trauma. And he's created a neurosequential model for addressing those areas. Over the last 7 to 8 years, he's adapted those best practices to the workplace. So they've worked with hundreds of corporations across the world, actually, on how to train their managers differently, how to create best practices within their human resources teams and other areas to support their workplace. So we're learning a lot from Kentla about that brain science to address trauma. And then 2, in our cohort, we have many of the top corporations across the city. And so those organizations in themselves have effective best practices that they use that have been beneficial. So we do a lot of cross-team sharing and creating a network within ourselves so that we can support ourselves. And then 3, there is the moving to action. And so the CRN, we've created an assessment tool. We've created a framework for action planning, and we have a resource guide. And so we work with our organizations to help them understand what's going great with their organizations, the tools and best practices they have in place that are good. And then we're working on them with them on priorities that they set forth for the next 12 to 18 months to prioritize what's important for their teams and for us to give them support with moving forward with those best practices. And so we are 9 months in with our first cohort that started in December of 2020. And so they've been learning together, and we don't have any slides, but we have great organizations in our cohort such as AT&T, Wintrust, a few of our hospitals in the area. And then last Friday, we just started with our second cohort with 11 organizations who are continuing to learn. So really excited about this work. It's a new space where employers are acting differently in this new world that we're living in to support their employees, because I think it was said, not everyone has a mental health diagnosis, but everyone has mental health needs. And so how can employers act differently and collectively to support their employees, which then support their families and communities to help our city become a healthier city, which is the goal.
Oh, well, thank you. Thank you for leading this important effort. And before I turn it over to Kim, and without going too deep into the weeds, can you just share very briefly how you're going to measure success here? And do the corporate goals differ from the individual employee goals? Or what's the overlap there? But mostly I'm just curious, and I think the audience is curious, like, how do you know if you're being successful here? Did you hear a thing I said? Denean?
Oh, I can hear you. I'm sorry. I thought the question was for someone else. I'm sorry. Could you repeat the question?
I'm sorry. Yeah, no, it was just a quick follow-up. Without getting into the weeds, how do you measure success of this program? And do the corporate goals align with the employee goals, or is there any tension there? But mostly, how do you know if you're making a difference?
Well, right now, we're still at the beginning of our program. So we haven't really had the opportunity to create those metrics for success and measure them at this juncture. But some of the things that we're thinking about are qualitative measures with regards to how effective is the training that we're providing, how many members of the teams that we're working with, how many people are being trained, and how many of our organizations are creating these action plans. And then as we move through them, how they are following through with those different best practices that they're creating. So right now, to answer your question specifically, we don't have specific measures to note right now. We're looking at building those as we move along our journey.
Yeah, thank you so much.
Mm-hmm.
So Kim, I'm going to ask you to pop in here. There you are. So tell us about the work that you're doing, both individually and collectively, I would say at the community level, to address trauma and resilience. And I know that you're a substance use expert, so I'd love to hear you talk sort of about how that impacts the work that you do and the people that you serve. And I also would be remiss if I didn't sort of acknowledge you're from New York, sort of at the epicenter of 9/11, and we just commemorated 20 years of sorrow and resiliency. So I'd also love to hear what your thinking is about how all the pandemics, the ongoing pandemics that we are challenged by, and any connection to 9/11, since it's also like school top of mind for a lot of people today. But really the incredible work that you're doing to build community resiliency, we'd love to hear about.
Oh, thank you so much. And so loved listening to everybody today, and always great to see you, Mark, and spend some time in Chicago, even through a camera. Certainly here at the HUG's office, we focus on individual, community, families. We take a look at all building protective factors all around, and how do we reduce risk factors. And so in some ways, a lot of our work becomes about working with individuals to help give them the skills and the tools that they need so that they can go out and be agents of change in their communities. And at a community level, we look at talking about how can we build in protective factors in the community? How can we help create opportunities for people to feel connected to their community? And on a parenting level, how to help foster healthier families? And how do we as community members go back to community parenting? And when I think about resilience and I think about how we will heal this, I often think about my grandma in Brooklyn, and it was her job to hang out of the window in Brooklyn and yell at you long before you ever got home, right? And she'd have a wooden spoon in one hand, she'd have her house coat on, and whether her teeth were in her mouth was a 50-50, but she was going to yell at you anyway, and she was going to look after the community kid. And so as we bring together this conversation of resilience, I want to talk about how do we coach up community parents? How do we realize that we really are responsible for our neighborhood children, and whether that's a suburban neighborhood, a rural neighborhood, an urban, a city, we are all responsible for our community youth. And so when we begin to realize that the conversation that we're sharing with youth is very much the same conversation we're having with adults, we often will go into schools and do a workshop for resilience with the young people, but it's the teachers who come and was like, I needed to hear that. The administrators, I needed to hear that. And so when we think about these moments, we can quick get those oxygen masks to people, not that they can put them on for long periods of time, but they can get a fresh new energy by us singing a song that they can hear and speaking to them. We really can begin to vibrate and change some of, and strengthen some of those community leaders that we see. You did bring up 9/11, and it was our 20th anniversary. And I often share that in some ways, I felt as a New Yorker, I mean, I'm so proud to be a New Yorker. And I felt that we had hit a good place with it, a sense of healing, a sense of understanding, never forgetting, and that we were kind of like, okay, getting our stride underneath us. And then to get hit with a pandemic, and most people will think that I will say COVID right now, but what I'm gonna actually say is the loneliness, the mental health, and the substance use disorder pandemic. We had a huge loss of life, with suicide, with overdose, with the opiates, and that impacted and rocked our community at a core. We just didn't talk about it a lot because of the stigma surrounding it. And so as we look to heal again and again and again, and I think that's resilience, is that bounce back. And although, there are many different ways that we can look at resilience or define it, but that bounce back and bounce back stronger. The thing is, we don't stop to ask when we're building our resilience or recognize that, oh, I'm building my resilience right now. We're just dealing with the crisis at hand in a moment. And New York has rallied and has walked through the same as most people would, because we never know how strong we are until we have to be exactly that strong. And so that collective call to action is happening again for all of us. And we get to work together to walk through and look out for one another, including our fields.
Yeah, wow. Well, thank you so much, Kim, and for addressing and bringing up loneliness, substance abuse, overdose, death, thresholds. While we were, I'm very proud that we lost very few, too many, but very few clients in the past year to COVID. We probably lost more clients as a percentage than any time in our history in the past year. I think from isolation, from loneliness to substance use, from disconnect from family and friends. Telehealth, we learned this past year, works for a lot of people, and it doesn't work for a lot more people. I'm all for telehealth, and the more that those with means and telephones and good Zoom connections can benefit from it, the more that we should, and we have to make sure that it's paid for going forward. But we have to remember that for a whole lot of people, it's not enough. Telehealth is important, it's necessary, but it's not sufficient. And it's just heartbreaking, the number of people that we lost this year to COVID related. That's not COVID specific. Mm. So speaking of loneliness, I'm going to turn to Gail. According to a study that was done recently by Cigna, of the 330 million Americans, a lot of people here, we are supposedly lonelier than ever. 61% of those surveyed by Cigna said they were lonely. 2 out of 3 people in this country are describing themselves as lonely. And it's up significantly in the past year. So Gail, I'd like to know if you could talk about this particular study, but also about resiliency. We keep coming back to that because I also know that Cigna has done some path-breaking work here as well. But if you could start with this loneliness survey and what you think this means. I said to you when we talked before, Bowling Alone by Dr. Putnam from Harvard. It feels like it was 15, 20 years ago, but it still feels like one of the most important books I've ever read in my life. And I started thinking then how I personally and professionally needed to address loneliness. And Dr. Vivek Murthy, our current Surgeon General, talks about loneliness all the time. And well before COVID, was talking about loneliness as perhaps one of the, if not the largest pandemic and a causal factor in many of our individual and social ills and challenges at the moment. So Gail, please share with us what you learned from these studies.
Yeah, you bet. Thank you so much. And I think a lot of people have been like, why would a health insurance company want to study loneliness? What does this have to do with, health and well-being? But it has everything to do with health and well-being. And like you said, we were looking at this before the COVID pandemic started. We launched our initial study in 2018, where we found that 2 in 5 people were in fact at, pretty high levels of loneliness. And we found basically that the younger you are, the more lonely you are. And I think that was a misconception that was corrected for a lot of people, thinking that, oh, it's our elderly population that must be the most lonely. But we found that the opposite was actually true. And the reason that this has a huge impact on our health is because it has the same effect on our bodies physically as smoking 15 cigarettes a day, right? We've been talking about how bad smoking is for you for years. But in fact, loneliness has that same impact on our bodies physically as smoking 15 cigarettes a day. So loneliness and health and our wellness are definitely connected. And when we repeated that study and really looked at loneliness in the workplace, we found that just in 1 year's time, we went from 2 in 5 being lonely to 3 in 5 being lonely. So I can imagine if we were to repeat that study, we may even see that be at a little bit higher rate. But what that study did was really kick off our resilience study. I think resilience is really that antithesis to things like stress and loneliness and trauma, right? As we've been talking about so far today. And a lot of the information and the results that we found in our resilience study were very similar to our loneliness study, just in terms of who was lonely and what those impacts were, who's resilient versus who has maybe some potential to maybe work on this. Colleen mentioned that it's like a muscle, right? That really needs to be built and worked and flexed and utilized, because if you don't, that in fact, can be reduced, and you might not have as high a level of resilience as you otherwise could if it was that muscle that you were working on. And so what we found in our resilience study is that about 37% of full-time workers are considered highly resilient. So that means that we've got, over 60% of our population that can really benefit from working on their level of resilience. The other thing that I think is important to call out there is that we found that full-time workers are the most resilient. So if only 37% of full-time workers are resilient, that must mean we have a long ways to go for maybe some of those folks who might be laid off, furloughed, and not working. So some of the things that we found were really just that lack of meaningful connection. So things like having support at home and in the workplace, even having a best friend at work, can make you less lonely and more resilient. But some of those other, key drivers to resilience that we found were things like exposure to diversity, a sense of community, and I think about all the communities that we're a part of, right? So not just at home, but also in the workplace. So we're a part of many different communities, but having that sense of community and a sense of belonging. And then another overlap between those two studies, probably no surprise, good physical and mental health, good family support. But all of these things, what we see is that if people don't have a high level of resilience and they're experiencing loneliness, that, they have a lower job satisfaction, lower job performance, higher turnover. They struggle to cope with challenges that come their way. And I know this was something that we didn't necessarily talk about, but I've been thinking about it as we've been talking here today. Are people familiar with the Great Resignation study that just came out? People heard about this. So the Great Resignation study says, and it's hard to believe because this year is going to be over before we know it, but that over half of people will still likely leave their jobs yet this year. And it's because a lot of the things that I just mentioned. So companies, employer groups now more than ever are looking at ways, what can we do to help retain our good employees, knowing that they've gone through some very unique stressors in the last 18 months.
Yeah, thank you. Thank you so much for this, Gail. And the work that I do at Thresholds, one of our mental health programs is actually a supported employment program. And all the evidence over the years suggests that meaningful engagement in work broadly defined, because everybody defines how they work and how much they work so differently, really has a huge impact on their mental health and their recovery. So thank you for sharing that. You know, it's interesting that you said that in this study, if not interesting, illuminating that children or young adults experience loneliness more than one would expect. Colleen, could you weigh in here? Because I'm curious sort of what your experience is on this topic, and what specific tools you're aware of, especially for children and young adults and families, to address loneliness. And I'm also curious because I was asking Denean about measuring success and impact of the trauma-informed work, and whether you have ways to measure your success in building trauma-informed, resilient schools and communities.
Sure. Yeah, I think the notion of loneliness is such an important one, and one that actually I think our mental health field doesn't always take as seriously as it should. So I appreciate this study and also the Surgeon General focusing on it, because I think it is at the core of a lot of things. And I think with children, what's interesting is that we think of children mostly, the younger ones especially, are in the context of their family most of the time, and then increasingly with their peers. And I think the notion of how do we build connections to peers and adults in really intentional ways is one thing that the study clearly highlights. So being in the same space with someone doesn't necessarily mean that you're not lonely, is what that study says to me. So what I think we have to think about is how do we teach those skills? And so I think there's a couple of things that are out there that can be really useful. There are a set of social emotional learning standards that our state has right next to their reading, writing, math, science condition. You know, we know what a preschooler and an elementary school and a high school kid should know, but we've got to prioritize that. Many districts have these, but they're not actually being implemented in really, robust ways. So thinking about why we need kids to learn these skills to be both contributing successful employees and connected socially is really critical. When we talk about trauma responsive strategies in schools, what we really think about, and what, even SAMHSA has really, if you look at what it means to be trauma responsive across all of these domains, from corporations to schools to community partner agencies, all of us, we talk about three basic things that come out of every study. One is the feeling of safety, physical and emotional safety in whatever space you're in, and being really aware of that and intentional. The second one is building those strong relationships. It's having those people who have your back, who you can be genuine and whole with and come to. And we need to be really thoughtful about how we build those. And then the third one is really building that sense of that I have skills, those social regulation skills, so that I can be resilient and bounce back, just like everyone on this panel has been saying. So I think if we prioritize those three things, we can really start to think about how we use the adults in kids' lives to build that sense of safety, to be intentional about relationships in all the spaces and settings that they come in contact. And similarly with adults, do we think about it, just like Mark said, telehealth is a great resource, and so is team approach to health. But having a relationship, when someone, I just heard yesterday somebody on the radio saying they're having fellows just call their patients, brand new fellows, brand new physicians out there calling their patients and asking why they haven't taken the COVID vaccine, or what their concerns are. And that singular act of somebody calling and that you trust is a game changer. So when we think about this work right now, I think, as I alluded to earlier, lots of people are talking about how to be trauma responsive, how to be healing centered. And I think what's exciting about where the field is going, especially for probably a lot of members in your audience, is we're moving towards that idea of, do we actually have operational definitions of what that looks like and some strategies for how to move it forward? And the good news for schools is that there is a tool available for free nationally that really does help you look at 10 domains, starting with the universal strategies. Do the adults feel safe? Do the community and parents feel connected? Is there adult social emotional learning skills? All of that universal, all the way up to, does your school provide trauma-informed interventions for kids that need it? And so there's a tool out there that people can access and that they can see where they are today, create those action plans, and then come together. And we've got an effort across the state to do that right now. We've created a platform where folks can join this process, and the State Board of Education is helping us expand it so that every school can do that needs assessment and make a plan, and then we can bring them together to connect. And like Denean was saying, and like we've heard, the same kind of effort is going on with corporations, with hospitals, with departments of health, with whole cities and whole states, saying, if we are in fact valuing this, how do we measure it? How do we come to consensus that we're all saying the same thing, and that your company that did 1 hour of a webinar and another company that spent 3 years in close, thoughtful process of learning are not the same? And how do we measure that and then give kudos and help people find those companies where they're going to thrive and where the kids can thrive and where adults can thrive? So I think it really is time to start moving us from the general constructs into, what does that mean? What does it mean as an employer if I walk into a space and I feel safe and connected to others? And then how do I build that space so that our employees can be safe? I loved your line about the talent crisis that we have, or that you had another word, but right, like people want to be connected and want to go to work, but we also want to know that if we're going to leave the safety of our families and communities, that where we're able to work from home, that we're going to gain something, gain relationships and connections.
So yeah, so the great resignation, that keeps me up at night. Even just to hear you say it, Gail, gives me ongoing PTSD. I think about this and try to create strategies every single day to recruit and retain and support the best. I would love to hear from Denean and Kim and others, Gail and Colleen. We have so little time left, but what are you doing specifically to address this great resignation challenge? We know that, Gail gave us the stats. It's happening before our eyes in real time. Any words of wisdom for the folks on this Zoom to help address the great resignation?
Mark, I'd like to add that for so many of us, we were almost had this relationship with being busy, that we were holding it as this badge of honor, right? I'm so busy, I'm so important, I have all this stuff going on. And so that became our identity. And so then the world kind of shuts down. And very much like young people had to figure out who they were when they weren't on the football field or on the stage, many adults had to be like, oh, wait a second, who am I? And some self-reflected and realized that they were kind of having this unhealthy relationship with how much they were doing. Maybe some people assessed and realigned and had an epiphany where they chose a different career path because they wanted to go to what made them happy. Others may have found that they stayed with their jobs, but now they're multitasking because they're on, I have an image that I use regularly. They're on Zoom, they've got their cell phone going, they've got another book going, and all these different things happening at once, feeding that Zoom fatigue, really made people kind of evaluate. And those who were kind of not sure that they were living in their purpose might have chose differently. And what I love is this new group of people who are realizing that they want to work in their purpose, and their purpose is making the space better and helping others. And so I think we're going to start to hopefully see some shifts and change, and new people coming on and into our workforce who really recognize the need and the importance of the body of work we do. And I would also add that using community coalitions, not just, using the strategic prevention framework for substance use disorder prevention, but to use the science of the strategic prevention framework to, yes, in fact, help heal and move communities forward in health and resilience is such an important tool that's readily available to us.
Yeah. So thank you, Kim. So we have 4 minutes before I have to turn it back to Megan. So I'm going to ask each of you to take 60 seconds and share whatever you want with this group based on this conversation, your ideas about resiliency, what you are doing personally in the ongoing multi-pandemic world, and any words of wisdom that you want to impart to the sum of us. And I'm going to start with Denean because she's smiling the biggest on my screen right now.
Well, I'm just going to build on that conversation. I'm really excited to work with top corporations to think differently, acting collectively and thinking differently. And so as we think about how to create, typically in the work site, you're interested in making money or meeting that goal. I'm really excited that employers are thinking differently about how they can support their employees in a different way by building community, training their managers in a different way so that they can recognize and have the tools that they need to have conversations to support their workforce and their teams. And so that's our piece. We're working with employers to figure this out and very excited. 3 years ago, employers would not be interested in this conversation, but the time is now to seize. So in the future, after this pandemic, we can still have these sticky points that are supportive for the workforce.
Awesome. Well, I have 1,200 employees, so I would love you to come and work with me. Just putting it out there. I am going to turn to Gail.
Yeah, hard thing to do in 60 seconds. But, you know, I think we're all trying to make sense and make meaning of everything that, you know, we've been dealing with as far as challenges recently. And I think doing that and finding a way to make some meaning and some sense of it can really help build your resilience on an individual level. If you are, you know, an employer, you're working, you know, at a manager, HR, you know, senior leadership level, whatever that case may be, you know that your employee force is looking at you for more resources than ever before. They're looking for, you know, good benefits that go just beyond coverage of care, but things beyond that to help foster and build that sense of, you know, emotional well-being and those resources that can really be utilized. They're looking for you to be a trusted source of communication. To be that regular influence. You know, they're really looking for something much broader and above and beyond, you know, what we've seen historically. So I probably talked for 60 seconds, so I want to make sure everybody else gets a chance, but those are just a couple things that come to mind.
Perfect. Thank you. Kim.
Grace. It's the word that just keeps coming up, and not only grace with others, but grace with ourselves. And I want to really bring it to that level of individual here, because we leaders lead, yes, and you've got some amazing leaders on this panel. And in the moment, in the crisis, leaders lead strongly, but then there's often an aftermath, and there's this kind of fallout that some may experience. And so gentle with yourself, gentle with others, and understanding that you are enough wherever you are, at the top of the corporate ladder or just starting out in this field, or a young kid sitting in second grade. You are enough, you are powerful, you are worthy, and you are in fact essential, and we need you here. So that's grace, and you're essential.
Thank you, Kim. If I could reach and give you a hug, as that sign behind you says, I would do it right now. And Colleen.
To follow up on that, I think, I guess what I would say is everything my colleagues have said about grace and connection and partnership, we have learned something in this year. And I guess my rallying call is that we have moved the stigma of mental health in a very different way. We have really decreased it during this pandemic, and I really call on all of us to maintain that and to continue to really think holistically about who all of us are as leaders, as employees, as family members, as children, all of those things, and to really think about how do we realign our resources so that we're not trying to chase the aftermath of the kind of trauma that kids and adults are experiencing, but instead really thinking from those public health lens and putting our resources to creating the kinds of communities that we all have had moments of. Many of us are privileged to have had many communities in our life that have supported us, others not as many, but we all know what that feels like. So if we can prioritize our resources to do that, and to bring all of you that are on this panel, but also all of you that are listening, to really think differently about how do we create that safe, loving, healing space for all of us to thrive. That's really what this time has taught us. It's been really difficult. And we've seen grace and love and sharing that we've never seen before, and a willingness to understand from a different perspective. So I have some hope as well.
Well, thank you. And that's just how I want to end it before I turn it over to Megan to close us out. I just want to express my gratitude to all of you and to all of the listeners and the viewers. I can't see the rest of you, but just enormous gratitude for you, our panelists, for what you do, but mostly for who you are. Some of you have inspired me for many, many years and give me such strength and courage and inspiration and hope and always new ideas about how to do what I do better for those that I have the privilege of serving and working with. And I love Zoom. I know I might be an outlier here, but the fact that I get to meet Gail and I get to meet Denean and I get to see Colleen and Kim is such a privilege. And I think about that all the time. As much as I am looking forward to not being on Zoom, I am so grateful that it has provided a platform for me to meet and interact with and get to know and love some of the most incredible people in the world. So with that, I turn it over to our co-host, Megan, who I see on my screen. So thank you everybody, and take it away, Megan.
Thank you so much. Thank you, Colleen, Kim, Denean, and Gail, for sharing your expertise today. And Mark, thank you so much for leading this important discussion. Today's program was brought to you by CommunityHealth, and all your ticket sales and any donations you make today and throughout the series this month are supporting CommunityHealth mission. Please consider making a contribution now to support CommunityHealth. I believe instructions should be appearing on your screen, and I'll ask Angel to drop it in the chat for you as well. So on behalf of the staff, board of directors, and volunteers at CommunityHealth, I want to thank you all for being part of the All-In series with Chicago. I hope that after leaving today you have ideas for how we can work together to make the vision of access to care for all Chicagoans a reality. We have 5 more events coming up throughout the rest of this month, and they are free to attend. I encourage you to check out the website, allin-chicago.org, to learn more about the great events coming up and register to be all in. We have a critical role to play in this effort, so thank you for being part of today's event. Have a great one.
Thank you. Bye.